Hi, I'm Cathy with Level Up RN. In this video, I'll be discussing tuberculosis or TB. And at the end of the video, I'm going to give you guys a little quiz to test your understanding of some of the key facts I'll be covering. So be sure to stay for that. And if you have our Level Up RN medical surgical nursing flashcards, go ahead and pull out your flashcards on tuberculosis so you can follow along with me and pay close attention to the bold red text on the back of the cards, because those are the things that you are likely to get tested on. Tuberculosis or TB is an infectious bacterial disease of the lungs caused by Mycobacterium tuberculosis. This bacteria is transmitted in the air when a person with active TB speaks, coughs, sings, or even breathes. In fact, TB can remain suspended in the air for several hours depending on the environment. After breathing in the bacteria attach to the alveoli in the lungs and begin to multiply. This triggers an immune response where macrophages come and ingest the bacteria, which leads to inflammation and the formation of granulomas. So granulomas are clusters of immune cells, and the presence of granulomas in the lungs is a key distinct feature of tuberculosis. Symptoms of an active TB infection include a cough that lasts for 3 weeks or longer, coughing up bloody or purulent sputum, night sweats, weight loss, fever, and chills. So all of those symptoms I just mentioned are the exact symptoms that we screen patients for during admission to the hospital. And if they do have those symptoms, then at most facilities, the patient would be placed on airborne precautions until TB can be ruled out. In terms of diagnosis of tuberculosis, there are several methods that you need to be familiar with. The first is the Mantoux skin test. So during this test, the nurse or other healthcare provider injects a very small amount of tuberculin, which is a protein obtained from the bacteria, under the skin in the forearm. So it's an intradermal injection. Then after that injection, the patient would return back to the office between 48 and 72 hours. So that timing is very specific and very important. If the patient comes back in 4 days, as opposed to 2 to 3 days, then that is too long and they would have to start the test all over again. So when the patient returns back to the office, the injection site would be assessed for induration. So induration is a thickened, hard area of skin. And if induration is present, then the width of that induration would be measured. Interpretation of the Mantoux skin test is based on 2 factors. The first is the width of the induration, and the second is the individual's risk factors for TB. So for a person with no known risk factors for TB, an induration of 15 millimeters or more is considered a positive result. So when I say a positive result, I do not mean good. It means the person has been exposed to TB and either has an active or latent infection. So for a person with an elevated risk based on a health condition, where they work or where they live, for example, then an induration of 10 millimeters or more is considered a positive result. And then finally, for an individual with a high risk of TB, such as someone who is immunocompromised, then an induration of 5 millimeters or more is considered a positive result. In addition to the skin test, there are also blood tests to check for the presence of TB. This includes the quantiferin Gold Plus TB test, as well as the T-spot TB test. So one important thing to note is that for individuals born outside the US who received a TB vaccination called BCG, a blood test is recommended over a skin test. This is because the BCG vaccine can cause a false positive result with the Mantoux skin test, whereas the blood tests are not affected by the BCG vaccine. If the blood or skin test is positive for TB, then the provider will order additional tests to determine if the patient has an active or latent TB infection. This can include a chest X-ray as well as a sputum culture. So with the sputum culture, typically 3 sputum samples are collected on 3 separate days. And it's best to collect these samples first thing in the morning before the individual has anything to eat or drink. Treatment of tuberculosis includes a combination of drugs, often up to 4 antibiotics that are taken for a long time, often up to 9 months. Some of the key antibiotics used to treat tuberculosis include rifampin, isoniazid, pyrazidamide, and ethambutol. Our cool chicken hint to help you remember these 4 medications is to think of a ripe orange. So ripe will help you to remember the first letter of each of these drugs, and orange will help you to remember that orange discoloration of the secretions is an expected finding with rifampin. For all the details of each of these medications, definitely check out our pharmacology video that covers TB medications. When caring for a patient with tuberculosis, there are some important nursing care interventions that you definitely need to know. So first of all, you need to place the patient in a negative airflow room and put them on airborne precautions. This means whenever you go into the room, you need to wear an N95 mask. And if the patient must leave the room for some kind of test or procedure, they will need to wear a surgical mask. It's also important to note that the patient's family members or other close contacts will need to be screened for TB as well. And then throughout therapy, treatment effectiveness will need to be monitored. This means the patient will need to provide blood, urine, and/or sputum samples periodically. And once the patient has 3 negative sputum cultures, they are considered no longer infectious. All right, it's quiz time, and I have 4 questions for you. You guys ready? Question number 1. What type of transmission precautions should be implemented for a patient with tuberculosis? The answer is airborne precautions. Number 2, with the Mantoux skin test, how long after getting the intradermal injection should the patient return back to have the skin test interpreted? The answer is 48 to 72 hours. Number 3, for a patient with no known risk factors for TB, an area of induration greater than or equal to blank millimeters is considered a positive result. The answer is 15. And number 4, a patient being treated for TB is considered no longer infectious after 2 negative sputum cultures. True or false? The answer is false. 3 negative sputum cultures are required before the patient is considered no longer infectious. All right, that's it for this video. I hope it was helpful. If so, be sure to hit that like button. And if you haven't done so already, be sure to subscribe to our channel as well. This means the patient will need to breathe. Treatment of tuberculosis, coughing up bloody or puty sputum, We invite you to subscribe to our channel and share a link with your classmates and friends in nursing school. And if you found value in this video, be sure to hit that like button and let us know what you found to be particularly helpful.